Chapter 1: Accessing Medical Records. Did you know you can request a copy of your medical records, but not your mental health records? Surprising, isn't it? This is not a random policy, but rather a well-thought-out decision, based on the principle of protecting patient privacy and ensuring the best possible care. Medical records, in general, are a compilation of a patient's health information. They include things like your medical history, diagnoses, medications, treatment plans, immunization dates, allergies, radiology images, and laboratory and test results. As a patient, you have the right to access these records. They are, after all, about you. Chapter 2: Complexity of Mental Health Records. But when it comes to mental health records, things become a bit more complex. These records contain sensitive information that could potentially harm the patient if disclosed. They include psychotherapy notes, which are notes taken by a healthcare provider during a conversation with a patient. They can contain details about the patient's conversations, feelings, and actions, which can be extremely personal and sensitive. Chapter 3: Restrictions on Mental Health Records. The law, recognizing the sensitive nature of this information, has placed restrictions on its disclosure. It's not that you can't ever get your mental health records, but there are limitations. These records can be requested for court proceedings, for instance, but not for personal review. Chapter 4: Protecting Patients. The idea behind this is to protect patients. Releasing mental health records to patients could potentially lead to self-harm or harm to others. For example, a patient with a diagnosis of severe depression might react negatively to reading their therapist's notes. The law seeks to prevent such situations by limiting access to these records. Chapter 5: Balancing Transparency and Patient Safety. So, to sum up, while you can request a copy of your medical records, you can't do the same for your mental health records. This is to protect your privacy and your well-being. You can, however, request them for court proceedings. This is a nuanced but vital aspect of healthcare law, designed to strike a balance between transparency and patient safety. Chapter 6: Empowering Patients. Remember, this isn't about keeping secrets. It's about ensuring the best possible care for you, the patient. And as always, if you have concerns about your care, speak up. Your healthcare providers are there to help. Understanding your rights is the first step to taking control of your health.